You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, Dr. Chip Castine. Dr. Castine, welcome to the program.
Thanks, Randy.
Now, we've had you on before. Thanks for coming down to our new studio here. Now, before we get into today's topic, tell us a little bit about your practice for those who don't know you. Pretty big, unusual. I've visited the place. Practice, tell me about it.
Out in the Southwest, I developed a center for dentistry that, quite frankly, 10 years ago, I couldn't have imagined.
I mean, you have an underground, you have a restaurant underground, you have a bunker there for sleeping, and a lab. I mean, it's really, and a theater also.
Well, the theater really is a room for training, because I know that what I need are great employees, and so there's got to be a classroom, there's got to be a center for study for the employees.
Okay, I didn't know that. I didn't know that.
But just to explain in most simple terms, it is, it's probably the nicest, most modern, and we just left nothing undiscovered. And it's wonderful. It's filled with wonderful modern art.
Why'd you do it? I mean, why that?
I thought as hard as we work, we deserve a wonderful design, great equipment, and our patients deserve the best design and equipment that money can buy.
Yeah, you wouldn't know it from the outside, by the way. I mean, when you go in the parking lot,
that's correct.
You go in, it's this great little world. I mean, the lab technicians are right up against the glass, making things. It's got to be fun for the kids, right, to watch that?
Right.
Even the adults.
Right.
Now, what kind of patients you see? I mean, I've had you on the show talking about dental implants, but I guess you guys do more than that. Who is your typical patient?
I don't think there's anything typical about my patients or my life, but I would say my patients, I would say 30% of them are ex-addicts. I would say...
Really? Like meth or I guess just drugs that have ruined their teeth?
You name it.
Okay.
From heroin to...
Interesting.
30% are aged, and the other 30% are just the general population that are missing a tooth.
Okay, so you do, I mean, what about things like cleanings and regular stuff like that? You
Well,
guys
we're
do that?
attached to Capital Dental Group. And
that's your business as well?
Correct.
Okay.
And all I do is hardcore reconstructive dentistry. The other part of the business handles all phases of dentistry, whether it's cosmetics.
Sedation, do you do sedation as well?
We do. We work with a fantastic anesthesiologist, and so many people have incredible fear of dentistry. And through...
Do you still hear that today? I mean, where they say, hey, Dr. Castine, I mean, do they tell you they don't like going to the dentist?
Are you kidding me?
Really?
We all dentists hear it all day long.
Are you kidding? Like, how do they say it?
I don't mean to offend you, but...
Really?
Sure.
So with dental implants.
But
go ahead.
I fight that, all right? Because I don't let them get away with that. Somehow, I'm going to entertain them, and I'm going to try to tweak them. And I do that really, quite frankly.
So you like hearing that, actually?
No, I don't like hearing that, but America doesn't have to be that way.
But it puts up a challenge for you in a way where you really want to give them this, turn that around?
Yeah, you turn that around by the atmosphere in your office, by the employees you hire, by the energy that you can come out with, and show them that, it's safe here, it's clean here. You can be part of our family. We will take care of you.
Let me back up. You said something, you used the word, you do hardcore reconstructive, I'm paraphrasing, but what does that mean? What does that mean? Hardcore dentistry, you do that stuff.
Can I show you some pictures?
Sure.
All right. This is a 14-year-old boy who, he's getting kicked out of school because he scares the other kids.
Really?
And I heard about it. And this is actually about a disease called xerostomia, which is a dryness of the mouth secondary to taking medications. And so this is just the horror of horrors. He's a very influential part of his life, and he's going to lose all of his teeth.
So you turned that around then? You worked with him?
Yeah. In fact, I did all of his dentistry for free. I got the implants donated, and I did about $60,000 worth of dentistry for free for that.
So now he's got a great smile.
He's got a great smile.
I mean, you think the smile's pretty important, by the way. I mean, you're a dentist, right? You should.
Hey, let me tell you, it's so much more than important. And when I'm looking at you, I'm looking at your eyes, as we all, when we communicate, look at people's eyes. But the bottom third of the face is defined by the mouth. And it's so critical to have a smile.
All right.
I mean, and when you and I don't get it because we got teeth.
Yeah, we've naturally.
But
yeah, I've
but
naturally.
85% of my patients don't have teeth, and they came to me not smiling, not being able to chew and swallow food, and
Okay.
it's not good. It's not a joke.
So you get the tough cases like this, and this one. What is this? This.
Randy, this is common. You know, these kind of people, when they have their lips around their teeth, that's not so noticeable. But when you get everything opened up, it's horror. It's Vietnam.
So these people are supposed to have their teeth removed, and they do nothing.
Well, I don't like the word supposed to. The fact of the matter is, events in life happened.
Okay.
And their mouth is it's a mess.
Are these the kind of people that wait too long? You know, because all of us, I guess, we put it off. Especially guys, put it off, put it off.
Guys love to wait too long. They will not come see me until the wife calls 5 times.
Because of the
drags them out
breath
of
and
the
everything else.
house. Yeah.
Is that right?
Yeah.
Would you like to see more of those people catching them early? What do you say to them? Somebody watching it right now, their mouth's a disaster. They're not smiling. Maybe they're ashamed to even go in.
Just get in your car and walk in. All right, just walk in the damn door. All
Okay.
right? And confess.
Okay.
Right? Because the faster you confess, maybe the more bone you have, maybe the easier and better choices you can have through your rehabilitation.
I talked to one of your employees, past employees. She says, Randy, I was working with Dr. Castine many years, and they're ashamed to even come in,
Yeah.
as if they're going to get guilt tripped or scolded by the dentist.
No.
But is that a legitimate fear? I mean, do you hear that? I was surprised to hear that.
Well, do people feel that way? Of course they feel that way. But Randy, instead of talking about the horror, let's talk about the beauty.
Because that can be turned around. That's an easy
Because that's what I'm in this game for.
Okay.
And the fun part of it for me is it's a new project, it's a new person, and it's probably the funnest part of being a dentist is taking something that is totally screwed up and making it a whole person again and making them comfortable, having function, and having wonderful aesthetics.
Interesting. We're going to take a quick break. We come back, some more of these stories and specific questions about dental implants. Who's a candidate? You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing dental implants. If you're missing one tooth or all of your teeth, and especially if you have a loose-fitting denture, or if you've been told your teeth have to go and you're doing nothing, you got to watch this next segment. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us, we have an expert on the topic, Dr. Chip Castine, and we've had you on the show. Always a pleasure to have you on the show. The dental implants, who is the typical patient that you see that comes in?
Randy, I've worked on a 93-year-old, and I think the youngest maybe was 17. But
93, they'll stick? I mean, you could do dental implants on a 93?
I think 93 is the new 75.
Okay.
All right.
All right.
But back to who is the typical dental implant patient, I'd say that they're missing a tooth or teeth. A typical case is someone's missing teeth, believe it or not, because they never got those teeth. For example, Valerie here, okay?
All right.
And
Is that rare to be born without teeth like that?
it's not rare. It's fairly common to have congenitally missing teeth. But when you're missing a tooth, your options are bridge work or implants. And it's so much more better for the body to have implants. It's the most beneficial, long-lasting restoration.
Is it like getting your teeth back? I mean, will they last like regular teeth? Is it-
Absolutely.
Okay. Can you make them matched up like with this kind of a guy? Those are, by the way, those are dental implants.
You know, it's the most challenging area to work is the upper jaw, out in front, high lip line. It can work. It does work.
So anybody missing a tooth.
Anybody missing a tooth.
Do the denture wearers benefit the most?
Denture wearers, I think, benefit the most.
Okay. And what are their options?
I said that denture wearers' options are to live your life with adhesive or consider dental implants and find different, and there's so many different ways to do this, Randy. And it's not only just the security of having the prosthesis in place, it's maintaining the bone volume underneath the denture that dissipates over time.
So you could make them where they snap in and out. You could give them something fixed. So for the denture wear, I mean, how many implants do you need to Give them something that can improve their situation.
I love having a minimum of 3 on the lower arch, all right, for something to snap into, because you can tripod this situation and it works well.